Hello, hello. Hi, Facebook. How are you? It is Dr. Emily, podiatrist, human movement specialist, founder of UBFA Global, and inventor of Naboso. So we are doing a webinar tonight. This is part 1 of 4 in a biopsychosocial series that we're doing. I did an introduction to biopsychosocial a couple weeks ago. You can find that on YouTube. This is now a 4-part series that was really based off of request to get the now what part of that webinar that we did. So if you notice certain chronic compensation patterns in your clients or patients, or they're holding on to chronic pain for a certain reason, and there is an emotional driver to that, to understand that concept is critical. That is step 1. But then your step 2, and what a lot of people were asking was, well, now what do I do? What are all the techniques to fix? Perhaps if my patient or client had childhood trauma, what do I do? What do I do if they're holding on to these involuntary muscle contractions? And that's really what this 4-part series is all about. I'm going to include a link to that. Part 1 again is tonight. If you cannot jump in on these live, they are all recorded, like all of EBFA webinars are recorded, and then you will have those videos for the rest of your life. You can reference back on those for the rest of your life, and you can watch them at your own time. So that 4-part series is 150. You can find that again on the link when I post that. If you want to do just piecemealing it and you just want to do part 1, you can absolutely sign up to that. There will be a link for that as well. That's $40. So we are talking about somatics. So another name for biopsychosocial is psychosomatic. So psycho meaning mind, somatic meaning body. And I'm going to take you through a series of somatic exercises that I've been doing for my body, and then I've started recommending to my patients as a way to override the involuntary, unconscious muscle contractions that they're holding on to. A lot of those are associated with trauma and stress, and it's kind of based on reflex patterns. So the way, based off of Thomas Hanna and his somatics book, highly, highly recommend that everyone checks that out. This book is incredible. There's a lot of other education you can look for under somatic education. But it is a series of 6 exercises, 6 somatic exercises that I'm going to take you through that I do, really focusing on T-spine and pelvic mobility. My goal with my patients is to get them ambulating to optimize their bipedalism. That's the foundation movement that we need to do. To achieve that, we must have sufficient T-spine rotation and pelvic rotation. So those 2 areas really need to be decoupled, and to have an override of these unconscious contractions that are happening, because that's honestly chronic pain. So I'm going to take you through those, and then I highly encourage you to check out the webinar series where we're going to be going into the history of psychosomatic medicine, as well as stress, trauma responses, trauma reflexes, things like that. It'll be really powerful. So we're going to start on the back. Now, everything that you do in these exercises is mind-body, mind-body. So of course we're connecting our breath and reminding the patient or client that it's not a competition. This is really important for movement professionals as well. This is not a competition. You're not looking at how far is Emily going through these movements, right? It is more, okay, getting the pattern, connecting to the breath, and then consciously moving through these patterns, okay? So you're going to start on your back. Everything's going to be a repetition of 10. Repetition of 10 keeps it easy. Hands are by the side. You're going to start by tucking the pelvis under, feeling the lower back into the floor, and giving it a little bit more of a conscious tuck. So use a little bit of actual effort. So exhaling, lower back into the floor, and then inhale, just relax the pelvis. Exhale, tuck the pelvis under, feel the lower back into the floor, and then inhale, relax the pelvis. You're doing that 10 times. Beautiful, good. And then you would go into the opposite. So now I'm going to push my tailbone into the floor, which is exaggerating the anterior tilt. This is going to be my inhale. Tailbone goes down. Exhale, relax down. Inhale, tailbone goes down. Push, push, push. And then exhale, relax. You're doing 10 to the front. And then we combine them. So you would inhale into the anterior, tailbone goes down. And then exhale into the posterior, push, 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 lower back into the floor. Again, inhale, go into the anterior tilt, push the tailbone down, and then exhale, lower back goes into the floor. 10 times. So already we've done 30 reps. Now you're going to go into, we'll call it a star. So the legs are straight out and the arms are straight out. I'm going to imagine that someone's pulling my right leg away from my body. So I'm growing my right leg. My right leg goes taller. Exhale, and then inhale, release. Right leg only. Right leg, make your right leg longer. Exhale, and then inhale. So these are conscious contractions that we're doing to engage the neuromuscular system. That was 10 times, beautiful. Now we'll go to the left arm. Now my left arm is growing. Someone's pulling my left arm, and then release. Left arm only, pull, 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 and then release. That was 10 times. Now we go to the left leg, pull, and release. Pull, left leg, 10 times, and then release. Right arm, obviously, right? So we know where we're going with this. Good. 10 times. Excellent. Good. Great. Now on to exercise 3. You're going to be bringing left knee over the right. Arms are just by the side so that you're here. You're going to take your legs and you're going to drop them to the left. So you're going to drop to the left. You want to notice how the pelvis is moving, and then we'll bring it back to the center. Again, knees go out to the left. This is honestly where I would exhale, and then inhale, bring it back. 10 times. Amazing. And then you're going to switch. Obviously, we're going to the right, and then bring it back. Cueing and bringing awareness. Do you feel how perhaps the muscles lengthening in the lower back, the QL, things like that? Always connecting mind, body, and then bring it back. And then we're going to go to the next one. Go back to the same position. This time your right arm goes up and your left arm goes down. Legs go out to the left, and your head is going to turn to the right. So head turns to the right, and then go back to the center. Head goes center. Leg goes left, head goes right. Beautiful. And then back. That's 10 times. Switch, obviously. Arm switch. Legs go to the right, head goes to the left. And then bring back. Pull. 10 times. And then we bring it back. Good. And then we're going to go up into a seated position. So if you want to do all of these exercises with your eyes shut, honestly, that's how I like to do them, then that further brings in that mind-body connection. So let's go a little bit closer. So you're in a stag position. So your left foot is into your right knee. And then you're going to rotate over to the right. So you're going to rotate shoulder, torso, head, and eyes. And then back to the center. Rotate. Back. Obviously, this is 10 times. Good. And then we switch to the other side. And then we're going to rotate. 1. Exhale. 2. We'll say I did that 10 times. And then we're going to go back to this one. And now what you're going to do is you're going to rotate all the way to the right. Bring your left arm onto your right shoulder. Stay all the way rotated. And now just your head is going to rotate. The head. Exhale. And if you want to keep your eyes shut, you absolutely can. Awesome. Obviously, we do the same thing on the other side. I know you guys know where we're going with this. So rotate. Right arm goes up. And then just the head. Rotate, rotate, rotate. Great. Now we go back into this position. This one is a little like a pretzel in a sense. So you're in that same staggered position. You're going to rotate and you're going to bring your right hand over your left. So you want to try to stay as upright as you can. So you are in this position, and now I'm rotating my left shoulder towards my left leg. So this is a lot into the T-spine, but it's actually really good. So left leg goes here, and then your head. So now I'm turning just my head. It goes all the way to the right. Okay? And I would be doing that 10 times. Great. Okay? Same thing on the other side. Right leg. This time your left hand goes over the right. You're here. Try to keep your right knee down. Rotate the right shoulder towards the right leg. And then just the head rotates. Okay, good. And then we go back. We're almost done with this series. We're here. Right hand goes over. Left goes back here. And now we're looking to the right. And you're going to bring your head down and all the way up. So you do that 10 times. And then obviously repeat on the other side. And then, just show you for symmetry, here, right knee, right shoulder, head down, head up, head down, head up. Good, great. We're almost done. And then you're going to go back onto your back for the last series of exercises. So you're going to go here, so you're on your back. Let's do my feet. You're here. And now we're going to mimic walking. So you're going to think of the pelvis initially. So you're going to pull your right heel down, and then you're going to pull your left heel down. So you want the client to notice, okay, the pelvis is dropping, the pelvis is dropping. So that's the mimicking that's happening when we're walking. So pelvis, the eyes can be shut. They can even visualize themselves walking. That's how far I would take it. Good, we do that 10 times. We relax, and then we want to bring it all the way into the rib cage. So you're going to go, right heel goes down, and you're going to imagine the pelvis and the rib cage opening up. So just make it go a little bit further. So now rib cage, pelvis opens up. Rib cage, pelvis opens up. Rib cage, pelvis opens up. Whoa, so it's even more, so like a bigger step. Or just bring it into how the rib cage should be moving. I'm just exaggerating it, yes? So rib cage should be moving as well. 10 of those, and then we go into the final one. Your right knee is going to bend. Your hands are by the side. You're going to push your right foot into the ground and engage the quad. And then you're going to bring your left hip into your right pelvis. Sorry, your left hip into the left rib cage. So right foot goes down, engage, so your obliques and your QL, and then release. Right foot goes down, engage, consciously engage QL and obliques, and then release. Right foot go down, engage, and release 10 times. Left foot, push your left foot down, engage your quad, consciously engage QL and obliques, and release. Push the left foot down, engage left QL and obliques, and release 10 times. And then good, release. Beautiful. So again, there are so many different somatic exercises. If you think, oh, some of that maybe looks like stuff that you already do, or maybe some of it looks a little like some yoga principles or gyrotonic principles, all of it is just bringing mind, body, breath connected, but it is consciously overriding the unconscious patterns that are happening in the body. The unconscious guarding trauma reflexes or withdrawal reflexes that happen as a result of stress and that are really part of the primitive brain. So again, these are my go-to. I encourage you to learn more and check out either Thomas Hanna's work, check out the webinar series that we're doing today. We're focusing all on somatic exercises, somatic theory, somatic syndrome, psychosomatic medicines, all of that concept. And then the next 3 ones, we're going to be looking at different concepts. I'm going to be doing a lot of different release work, so holotropic breathing, sound meditation, Psych K, tons of stuff to just show you the wide range of what now can you offer those patients besides just understanding biopsychosocial, but what else can you offer? Even if you don't do it yourself, how can you guide them down that path of healing and letting go of that stress and trauma? I hope you guys are amazing. Have a great day. Stay barefoot strong, and I hope to see you on the webinar. Take care.